This program is brought to you in association with First National Bank of Botswana.
FNB, how can we help you?
COVID-19 came into our lives like a thief in the night, robbing us of life as we knew it. The global economy was in shambles for months. Businesses collapsed. Millions lost their jobs, with whole industries, such as the tourism sector, almost non-existent. The only way for stability to our economies and to have back a sense of normalcy was for a vaccine to be made. And it was, for which the first emergency use approval was announced in December last year. The vaccines, amongst them Pfizer, Moderna, Sinovac and AstraZeneca, have managed to save lives and bring a sense of hope to a gloomy outlook. Even then, there's still so much that we do not understand about these vaccines and about the pandemic itself. Tonight, we bring you a special episode of First Issues where we will be discussing the most frequently asked questions about the pandemic. And this being a medical issues conversation, we have brought in the expertise of Dr. Kiran Bhagat. On the segment, we start with what the experts refer to as COVID-19 vaccine breakthrough infections. What is this? Doctor, thank you so much for coming on First Issues and affording us your time today. We're talking vaccine breakthrough infections. And let's start first. What is the risk of a person getting infected with COVID post-vaccination?
Well, it's important to remember, Puranseko, that no medicine or vaccine is 100%. You know, there is a unexpected request or demand from the public that when you're vaccinated, you're 100% protected. The vaccines in our history, in the history of medicine, have never been 100%, whether it's measles, mumps, rubella, diphtheria. There's always going to be a certain percentage that don't respond well to a vaccine or to a medicine. And so, the unexpected requests from the public, and in fact, particularly the anti-vaxxers to say that it doesn't work, is this idea that people who are vaccinated still get infections. They do. And it's just important to remember that when an individual is vaccinated, there are also issues surrounding that particular individual. Is the individual on some medication? Is the individual having an immune system that's already suppressed as a result of cancer medicine, autoimmune diseases that for which they're taking medicines that suppress the immune system, HIV, debilitation such as previous lung disease. So those things already make the body susceptible in spite of the fact that the vaccine is working. So what is important to understand about the vaccines, and pretty much all the vaccines that are available in Botswana, is that the majority of vaccines will prevent you from a hospital admission or death. It may not stop you from getting COVID, but it will reduce the impact of that COVID so that it becomes, at the worst, a bad case of flu. Those that have succumbed and died in spite of the vaccine often have underlying conditions. One must also remember that different age groups respond differently to the vaccine. We know that if you're younger, the vaccine response is much better because you have a stronger, resilient immune system. If you're elderly, we know that your immune system is already, because of age, not able to mount the artillery that is required after vaccination. So the effectiveness or efficacy, as we call it, is less. So it's important for the public to realize that vaccination is important, but to continue the things we've talked about before, the mitigating factors after vaccination, don't be reckless. What has happened in places like North America and in Europe is the public have gone on a rampage after being vaccinated and dropped their masks and gone to pubs and restaurants and crowded situations. And of course, that encourages those that are not vaccinated to acquire an infection and subsequently rise in the numbers in North America and in Europe.
So post-vaccination, what are the chances of actually spreading the disease to other people?
It's extremely small. The data is still coming out, but particularly data that has been studied with Pfizer, with Moderna, with Johnson & Johnson and Novavax, the data shows that if you are vaccinated, the chance of you infect anybody else is very low, because if you yourself as a vaccinee, somebody who's had a vaccine, is in the presence of somebody who has COVID and you breathe in that COVID virus, the vaccine that you have taken in the majority of situations abolishes, eradicates or reduces the number of viruses in your system, so you're not able to transmit the load of virus that if you are not vaccinated. It's important to remember that to catch a cold, the best way to catch a cold is to be in a closed environment where there's no ventilation and somebody is sneezing directly into you, because the quantity of that flu virus is the amount that you're breathing in, and the quantum or the quantity that you breathe in of the COVID virus is then likely to be determining whether you are going to get infected or not. But if you're as a vaccinated person asking the question, the answer is very low. The issue is, can you transmit it to somebody else? And the answer is yes, you can, in those who are not vaccinated. Because even a small amount in somebody who's not been vaccinated is still a danger of catching COVID.
Post-vaccination, would it be safe to be around other vaccinated people but unmasked?
If you're vaccinated and you are in the presence of somebody else who's vaccinated, the chances are much less, which is the reason why in Europe and in the US they opened up, because the majority of people who were allowed to get into a restaurant had to demonstrate that they're vaccinated. And so there was some security and safety in the knowledge that whether you went to a bank or whether you went to a restaurant or a hotel or even to a pub, that the people in that pub have all been vaccinated. So the chances are much, much less. Of course, this has sparked controversy in terms of the ethics of having a vaccine passport for those that cannot take the vaccine. For example, children, for example, pregnant women are more reluctant, people who have underlying conditions that put them at risk to get the vaccine. So the ethics and morals of this are still something that is being debated worldwide. And as you've seen from public news, there are protests going on in other parts of the world to try and counteract the effects of a vaccine passport. In terms of us, I think it's important to realize that we fortunately don't have such resistance, and the public are by and large willing to take the vaccine. So if the majority of people are vaccinated, it just becomes a safety factor and a responsibility that if you're vaccinated, at least you're protecting yourself and you're protecting other people.
Can a vaccinated person visit their elderly relatives confidently and comfortably, seeing that they are, after all, the most vulnerable to this disease?
This is an important issue, Puranseko, and I think the most important bottom line message is that it's safe to visit your parents or your grandparents if you are vaccinated and they have been vaccinated as well, because then that puts you together, just like going to a restaurant in the company of people that are vaccinated, puts you at ease that the protection for your granny or your granddad or your aunt is equal to that of yours, provided the person you're visiting, whether it's a granny or a grandfather, doesn't have pre-existing conditions which may predispose them, because you may still carry the virus although you are protected by the virus. So think about the circumstances. If granny is a diabetic or she has lung disease or she's an invalid or she's had a stroke, be careful in terms of their company. If they've been vaccinated, you can be assured that the chances are very slim. If they're not vaccinated, it's very important to be masked in front of an elderly who's not been vaccinated. And we hope that in our situation that is a less and less of a recurrence. We
keep hearing of booster shots, so are any advantages to getting one?
We're not so lucky in the situation that we really have a rising issue of COVID, and certainly in the UK they are trying to pressurize that everybody over the age of 50 at least get a vaccine, a booster vaccine 6 months after either receiving AstraZeneca or Covishield or Pfizer, because a large study published just last week from Israel showed that getting the third vaccine, they used Pfizer, produced a substantial improvement in immunity. One must remember that vaccinations of any sort, for example, annual flu vaccines, the reason why we give annual flu vaccines is that the vaccine strength begins to wane with time, because the body forgets about the vaccine. And so that waning immunity is something that we're all aware of, particularly with COVID and the use of the booster. In addition, with the arrival of the Delta variant, this has also set a new precedence in the sense that we know that the Delta variant is much more transmissible. We know that younger people are being infected by this. And being vaccinated, getting the majority of people vaccinated at least with their 2 doses, with Johnson & Johnson 1 dose, means at least there is less likelihood of the emergence of resistant variant Delta viruses or Delta variants in the future. So the booster vaccine is an issue that we will debate in this country, and certainly I'm of the opinion that a booster vaccine should be taken by people over a certain age.
When we come back from commercial break, we will be continuing with the special episode on COVID-19 frequently asked questions. Stay tuned to First Issues.